Welcome to the Life Changing Moments podcast and the second installment of our special four-part series of conversations with Chief Wellness Officers. In our previous episode, we spoke with Dr. Mila Felder of Advocate Health, who shared some of her personal journey as well as her passion for and innovative and collaborative approaches that she takes to addressing the challenges faced by frontline healthcare professionals. In this episode, we continue this exploration by speaking with another Chief Wellness Officer who is also at the forefront of developing systemic improvements, but also involved in leveraging coaching to support healthcare professionals. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life Changing Moments. My guest today is Dr. Christina Bowen, Eastern Carolina University Health's Chief Wellbeing Officer. Dr. Bowen also serves as Medical Director for the Center for Healthy Living and the Dare County, North Carolina Health Department. Dr. Bowen earned her medical degree from Eastern Carolina University, completed her residency in family medicine at Carolinas Medical Center in Charlotte, North Carolina, and finished an integrative medicine fellowship at the University of Arizona. She is multiply board certified in family medicine, hospice and palliative medicine, lifestyle medicine, and integrative medicine. As you might surmise from her background and training, she's passionate about improving the well-being of her patients, colleagues, and her community. As this series has a bent toward well-being, I'm sharing what our guests do to keep well as well. Dr. Bowen enjoys strength training, running, prayer and meditation, skiing, reading, and traveling with her family. She lives in the Outer Banks of North Carolina with her husband, an orthopedic surgeon, their 3 children, and their 2 dogs. So, Dr. Christina Bowen, welcome to the Life Changing Moments podcast.
Thank you so much, Dale. This is such a delight to get to spend time with you. Always a treat over the years to get to hang out with you and share space with you.
Yeah, thank you so much for taking the time to be here. And for listeners who have listened to the podcast before, know that I'm coming from Charlotte, North Carolina, and you're across the state over at Eastern Carolina. Tell us a little bit about where you are geographically and what you're up to out there.
Yeah, I'd love to. So I am currently living in the Outer Banks of North Carolina. That's where I practice clinically. At the Center for Healthy Living. And then I get the honor of serving as the Chief Wellbeing Officer for ECU Health. And so my administrative responsibilities bring me to Greenville, North Carolina. So I have a little bit of a hybrid. I both work clinically in the Outer Banks, and then administratively I work in Greenville, is where my central office is. And then I get to travel all over the 29 counties that we serve with ECU Health.
Wow, and that's a pretty big area, as I know.
Yeah.
So that traveling must take you far and wide.
Yes, it does. It's really wonderful. I'm from Eastern North Carolina, and so it truly has been a joy to get to travel and the place in North Carolina that I've called home for the last 48 years. So I enjoy getting to go to all of our community hospitals and hang out with our team members and our physicians and credential providers there.
Well, that's great. I think there's something that we hear about that's very special for especially physicians who get to go back to the communities that they grew up in and give back to the community that they came from. So good for you for being able to have that experience.
Yeah, just to play on that, it's so true. And, I hadn't even really thought about it. I think about that all the time. My husband tells me all the time, well, you are so purpose-driven in this role. And I think it truly is, to your point. The mission of ECU Health is to take care of the health and well-being of Eastern North Carolina. So it's deep in my heart that's by taking care of the team members and the physicians and credential providers that I get to connect to that little piece of my purpose in caring for Eastern North Carolina, which is an area that I love.
Which is a great segue for us to kind of dive into this. You're the second in our series in our conversations with well-being officers. And I love what you said. So there's a part of your life where you are taking care of patients. And then there's this other significant piece where you're taking care of the people who take care of patients.
Yeah.
Which is a way of really caring for that entire region. So I'm curious, Christina, what sparked your interest in this healthcare professional well-being?
It's interesting. I got to start working with our Chief Experience Officer, Dr. Kennedy Oehlert, that's actually doctorate prepared in nursing, and started designing some modules and salons for our team members that really were focused on a holistic strategy to their well-being. And then this crazy thing called COVID hit, and we really knew that we needed to have a strategic focus on the well-being of our team members and our providers, our physicians and credential providers. And so at that time, I was in a role, I was at that time the medical director for the Office of Experience. So I stepped into that role, really thinking about strategically for our organization for over a 2-year period, like what are some ways that we can innovate in caring for the well-being of our healthcare workers at ECU Health. And I think part of it is that I did a fellowship in integrative medicine, which really does take that holistic approach to well-being. And I think that was what sparked Dr. Oehlert. She and I had that connection. She'd been at the University of Arizona. And so I was able to bring in that training around integrative medicine and that mind, body, spirit approach and what that looks like when we think about healthcare worker well-being. And that's really been wonderful launching pad. And now, as you can imagine, has evolved into a lot of different strategies. But really, my start was really at the beginning of the pandemic when, as an organization, we recognized that we needed a person to be thinking about the well-being of our team members and our providers.
And great that there was that your system had the forethought to recognize the talent that you have in that area and to bring that to the healthcare workers. Not everybody did that, and not so well. So that sounds like, from there it has evolved to your current position. What's different about it? So there's the holistic care of the individual provider, but what else have you built in your role?
How it really evolved is, I think at the beginning when we started thinking about healthcare worker well-being, we were really intentional about their emotional well-being. Like, how are we supporting their emotional well-being? Just living through really, truly an unimaginable time. And so that was truly our focus at that time. And it evolved as we've, come on the other side of the pandemic. We've really thought about, okay, so how do we broaden that scope as we think about well-being? And so we really do take that holistic approach. Like, are we thinking about our team members' physical well-being by what we're feeding them in our cafeterias and what we're catering when we have events, and with our wellness center memberships, and how are we allowing them to have activity at work if they're able to? I mean, some of our clinical team members, that's not possible, but how are we increasing? So being thoughtful about them individually. And while we're thinking about it, I really like Stanford's model of professional fulfillment that has the piece of, the personal well-being piece, but then it also has the piece of what's the culture that we're creating at work that really supports their well-being. So are we creating psychological safety? Are we allowing for brave spaces so that we can really innovate and change in this time when we really need that in healthcare? And then, the quality and safety piece of that model is, do we have efficiency of practice? Because as you think about all of our healthcare workforce, we want to be giving safe, highly reliable, human-centered care to our patients. And we have to have efficiency of practice. That's, as I've stepped into this space as a physician, it's one of the things that we know are, how are we optimizing efficiency of practice for our providers so that those administrative burdens, and sometimes we call them pebbles in the shoe, how are we helping to decrease some of those pebbles in their shoes so that they really can connect with what they want to do, which is really care for patients, right? And not have to deal with some of those other things that really sidetrack us when we're in clinical care.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians for physicians to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview.
This really grew from individual caring for somebody who is maybe depleted as a result of caring for COVID patients to really a much more systemic view.
Right.
There's including the culture of well-being, as well as this recognition, as we've heard before on this show, about the addressing administrative burden so that clinicians get to do what they do best, which is to be clinical, which is awesome. I wonder if you have a story or an anecdote that highlights the importance of the work that you're now doing.
One of the things we've done for our physician leaders and some of our APP leaders as well is we have a 3-day leadership retreat that is truly focused on them, right? It's focused on their personal well-being. It's really the premise of it is lead self, lead your team, and lead the culture. And the incredible work that I've seen out of that, I think we're in our 7th cohort of doing 2 3-day immersive leadership retreats every year. And I think we're on our 7th one, and we have about 20 participants for each of those. And so we've really created a community that really is truly focused on well-being and that life-work harmony, that kind of thing. What we've seen that's incredible is that we know that it's a both and, right? It's individual well-being, so that when you walk into the clinical space, you lead with your A game. And what we've seen is when people really show up and they are feeling like the organization supports their personal well-being and their well-being at work, we have this incredible synergy with people that have gone through that program together, or who have gone through one of those programs. Like, we're human beings, right? First, coming into this space to do and practice medicine. And what that's done is it's allowed us to truly have a relationship-based culture. And I have watched meetings occur between people that met before they went on this retreat, and they come back, and the way that you interact, it's on a different level. It's truly like human being to human being. How do we come together? It unsilos work. It leads itself to collaboration and partnership and relationship. And I've just seen it where it just makes projects work that much more smoothly. And truly, the projects that you're working on are much more efficient. And they might have, in theory, nothing to do with well-being, and just how the people interact with one another. And that's truly culture change, right? So I've seen it impact the culture, and how when you have a culture of well-being, that the downstream effect of that is enhanced, patient care, enhanced patient experience. And so, because how we experience each other is how our patients are going to experience us. And so it's really been amazing to see. And gosh, I could think of lots of different examples of initiatives that we've done inside the system that truly are impacting the culture. And that's what's just, it's magical to watch, because, in my heart, I know that's impacting the health and well-being of Eastern North Carolina, which is our mission. And it's taking care of our people.
That is really, really awesome to be part of that culture change. I want to back up just a second. You talked about these retreats as being pretty transformative for the leaders. Yeah. Is there an element or a combination of a few elements that you can speak to that seems to really create that transformation that you talked about?
Yeah, I think that's a great question. First of all, it's away from work. It's a 3-day retreat where these leaders get to go to, all hang out together for 3 days. They get to, eat dinner together. They eat breakfast together. And we really say, this isn't about work. This is truly about you and your personal well-being. And this is an investment in you. And you and I both love coaching. And so it's truly based on fundamentals around coaching, right? We're asking really powerful questions, really holding space for what is core to me. What am I claiming? Who am I claiming that I am? And there's power in a group. So there's 20 people that get together and they share this space together. I can't give too much away because it's kind of Vegas. We're not supposed to tell all the ins and outs of it, but just this amazing collaborative networking of people that don't talk about work. And they're just like, hey, I am a violin player and I'm a mother of 3. And, I'm from New Jersey and I landed in Greenville because of X, Y, and Z, or I landed somewhere else in our health system. And so they really relate and get to know each other as human beings, like I just talked about. And obviously some work will get woven in there, even though we say, don't talk, leave work at the door. We ask people before they go on the retreat, how many of you have had 3 days to really just focus on yourself? And most people are like, oh my gosh, I haven't had 3 days in a really long time, or never. And so out of that, overwhelmingly, we've seen it positively impacts engagement scores, which we're not doing it for metrics, but it enhances the culture. We know that it's improving the culture, and they walk away and they feel, we get, with the surveys, the comments are, I feel like my organization cares for my personal well-being. I truly feel cared for because I can tell this is an investment in me. And that means a lot to people.
And it sounds like that is sustained after the retreat.
It truly is sustained. It's been incredible. We just had our alumni retreat about a month ago. And it was it was just so, we use the consultant group, One Team Leadership, actually, that's out of Charlotte. John DeFries and I we facilitate those retreats together. And we just stood back, and it was incredible to watch people connect. And there'd be, the cohorts, they all went through it together, the 20 that went through together, but then there'd be people that didn't go through it together. And the way that they connect, it's human being to human being. It's a relationship-based culture. And it's so fun to then walk outside and be in, some sort of other administrative meeting and watch people, how they relate to one another. And then when they say, hey, this is something we need to change, how they lean in, which change can be scary and people want to back away, but they actually want to lean in because they're like, hey, you know what? I have a relationship with you and I'm assuming best intentions. And it really is helping us to move the culture forward.
I get to see you because we're doing this on Zoom. And I just want to, for listeners to know that you're just, you're radiant as you're talking about this. And I'm guessing that you have been a spark for your organization to really have these wonderful things happen. It sounds like the things that you have implemented have been very impactful, and I realize you're also early in this journey. But you keep coming back to this culture shift, and I want to just highlight that. And I also want to ask you, with all those successes, what are the biggest challenges, going forward, just in general for healthcare professional well-being?
Well, as it relates to this, one thing I'll say is that it's been incredible to have a senior leadership team that supports these efforts. That's just been, to have a CEO, to have a chief clinical officer, to have a chief experience officer that are like, we have to focus on our most precious resource, which is our, healthcare workers, has been amazing and has really helped us to move these initiatives forward to have that. And then, I would say from a well-being space, financing these initiatives are tough. And then when I think about, the system, I really do think that's where we have to focus. I think it's a both and. I think you have to think about how are we caring for the personal well-being of our healthcare workers, and then how are we working on some of the systemic issues that we know are really, unfortunately, driving towards burnout or just people wanting to leave the profession. And sometimes that can feel like you're trying to boil the ocean, right? So from the, like administrative burdens, or people will say the electronic health record, and I'm not being toxic positivity, but I am optimistic and I'm hopeful that there is such a light that's that we're shining on the importance of healthcare worker well-being, that yes, it will be chipping away a little bit at the time, but I do truly believe that there's so many levels, even from like the North Carolina Medical Society and the medical board, like a lot of people are paying attention to this. And I think together in some of those bigger issues, we're going to start seeing movement. And I think we already are starting to see movement in a positive direction.
You've mentioned a few of those issues. And are there any particular stressors now that are a little more prominent than even just a couple of years ago?
A couple of things that I think I hear right now is, accessibility is really hard. We know we're at a shortage right now, specifically for primary care. And so how do we maximize accessibility, right? And so as a family medicine doctor, it's hard to see a really complicated patient in 15, 20 minutes. And so I think that's hard. And I think, we're in an aging population. I think we've continued to see the need go up for primary care. And so I think that access to care, it's almost like moral injury, I feel like, for primary care physicians too, because you want to be available to your whole patient panel and you just can't. Yeah. And so I do think that is more of a stressor than it probably was when I'm thinking about when I did residency with you, right? When, 15 years ago, I do think that that's more, and I've heard that from providers, that access. Another thing that I hear all the time too is in-basket messaging. I think it's kind of a double-edged sword. It's a blessing for our patients. I think it's really great. And I think we're learning how to be more efficient around that. And so I think that can be hard. And then the other thing I hear a lot about is prior auth.
Yeah, which is is perpetual.
Yeah.
Yeah. Not enough said, right? Enough said.
Yeah. I'm holding my hands up. Like, I don't have the answer. Yeah.
Yeah, right. So, which leads me to my next question, and you've kind of alluded to this. It's like, yeah, I love this image that you said is like sometimes it feels like boiling the ocean, but then you have this ability to say, let's take it a piece at a time.
Yeah.
And so, what innovative approaches or technologies do you think hold promise for enhancing professional well-being in the days, weeks, months, and years ahead?
And I'm not the expert in this space at all. We have an amazing informatics team at ECU Health. And, I'm curious to see how AI actually might help us in this space. I do think that the focus that we're having at a national level and the state level on healthcare worker well-being truly is shining a light. And I think it's going to help us move forward on some of the burdens that we experience as physicians and APPs, because it's really like it's a movement. It's not just me trying to boil my ocean in Eastern North Carolina. It's like we really recognize that this is something we need to focus on nationally. The North Carolina Medical Society has a new consortium around provider well-being, that's a strategic focus on this. So I feel like a lot of organizations are coming alongside one another and really locking arms on this. And so I think that's going to be really helpful. And I think that's been in the last few years. And I think we'll continue to see heightened focus.
Sounds like what you're saying is raising awareness from the in the trenches physician to now consortium of physicians and others, recognizing what those issues are and coming up with some solutions.
Yeah.
You're kind of bringing up, some systemic issues which are being addressed in a gradual way. I want to bring us back to the individual healthcare professional, as some of whom are listeners to this show. Yeah. And if they are sort of experiencing my well-being is not so great, what are some of your thoughts about proactive steps that they can take to manage their own well-being?
I truly think, and this is from a personal level too, the most impactful thing and the gift that you could give to yourself is to get coaching. I think having a coach, first of all, it's prioritizing your well-being. So that's the first step, saying that I actually need to be well before I can take care of probably my family, my patients, my friends. So first of all, prioritizing yourself. And then if you were going to ask me what tool do I think is the most powerful when I am talking to other physicians and APPs that are experiencing disharmony, right? They're like, God, I feel a little bit disillusioned a little bit around medicine. I really think coaching, because I think, number one, I think getting personal coaching, because you have all the answers. You need somebody to ask you the questions and hold space with you. I really just think that's the single most impactful thing that you could do to really figure out, what do I really want? What do I really need right now? And then from a physical well-being space, I would say health coaching is amazing, right? So that's that whole, am I moving my body? Am I nourishing my body? Am I sleeping? How am I managing my stress? So that aspect, I think health coaching, personal coaching, life coaching, executive coaching, I think is probably, and I think I would start with that.
That's awesome. And it's a little bit of what we're trying to promote here at MD Coaches as well. So you did that for us and you saved me the question. Given that, and you kind of talked a little bit about what people who are considering coaching, what they can expect from that. I love what you said, that you have the answers. You just need somebody to ask you the questions so that you can be reflective and develop insight so that you can find yourself moving forward and moving yourself out of that sense of not well-being. I just wondered if we've covered a lot, and are there any other resources or tools that you have not mentioned yet that you would recommend for those who are looking to improve their well-being?
Well, for their personal well-being, I think that, well, I'm biased, but I say an integrative and lifestyle medicine physician, go find yourself one. They're great. I think that's great. I think getting a coach, if it's somebody that's a leader, that's a physician leader, and you're thinking, what can I do for my organization? Having a physician and APP peer support program is incredibly powerful internally. We've seen that at ECU Health. And then always a mentor. If you're listening and you're a new physician or APP, having a mentor, there's pretty good articles out there for you to read about the power of having a mentor. So having somebody that can come alongside you. One of the things that we know is that unfortunately, medicine is getting more isolating. I was referencing when I was in residency and we used to go to the reading room and we'd see all the physicians in the x-ray room, and we don't do that anymore, right? And so finding that sense of community and connection is really, really important and can be hard, right? With charting, et cetera, it's more and more isolating. So just recognizing the importance of connection. So that mentorship is very important. Another thing that we're doing in partnership with with a coaching entity is we're developing an internal coaching program. And so I would say, I've already said the power of coaching, but we recognized at ECU Health just how powerful creating a culture of coaching is, so that we're trying to create that internally. And so I would any physician or APP leader, I would say look into that for your organization.
So, Christina, I know the answer to this, but I want listeners to hear how long you've been at this in this role, because you've accomplished a lot. So how long have you been doing this?
I have been doing this for 2 years that I've been in this role.
So I just want to say that's an amazing amount of work and accomplishment that you've done in just a very short amount of time.
Oh, that's very kind. Well, it's incredible. I have such an amazing team that walks alongside me and that really shares my passion in healthcare worker well-being. So it's truly incredible. And like I said, just to have partners on the senior leadership team with me that are equally as invested in the well-being of our people at ECU Health it's phenomenal. And I think that's really helped us to get to where we are today, for sure.
Listen, before we sign off, is there anything that I haven't asked you that you would like to impart to the audience that you haven't had a chance to say yet?
I would just say, as a physician, I still practice, right? I'm still clinically active. And I'm assuming most of the people that listen in are physicians and APPs that are practicing. And I would really say, I truly believe that it's a sacred art, right? To get to hold space with people and for our patients to trust us and let us be on this healing journey with them. And so for those of you out there that might be like, well, I don't know if I want to do this anymore, I would say, try some of these resources that we've talked about. I would say maybe just pick up the phone, and I'm not doing this is not a coaching ad, but I would say pick up the phone and have an introductory coaching call. If that's the one thing I could tell you to do, just to talk through that and have an objective person, it's just incredible. And it really opens up space. You can have a life that you don't need a vacation from, but you got to be really intentional. And you got to prioritize your personal well-being. And I would really challenge you to do that. We need you taking care of patients. And so make yourself a priority so that you can stay in this really cool career that we've chosen to do.
Well, those are really wise words of wisdom. And I want to just say, Christina, thank you again for being here. I think your patients and your community and ECU Health is really fortunate to have you as part of the team. But I also hear there's a lot of people who are invested in the well-being of not just the healthcare workers, but the well-being of the community. And great that you were in the right place at the right time. And they have you to help lead them along that. So thank you again so much for being with us. And I wish you all good tidings and be well.
Thank you so much for having me, Dale. This was a treat.
I'd like to once again thank Dr. Christina Bowen for taking the time to be interviewed for this podcast. Her contagious energy, optimism, and can-do attitude is an inspiration and gives me hope for healthcare. In our next episode, we'll continue our exploration with another leader in healthcare well-being, Dr. Christine Hine from Portland, Maine. She has a most compelling story which informs why she's so passionate about working in the professional well-being space. Join us for Life Changing Moments episode 47 in about 2 weeks. I'd also like to once again extend an invitation to all listeners. We'd love to hear your thoughts on the topic of professional well-being. What are your experiences in this space? We'd like you to visit the SpeakPipe link in our show notes to leave a voice message with your ideas, experiences, and suggestions. Your contributions might be featured in a future episode, helping us to continue this essential conversation. Remember, your voice matters. Together, we can make a positive impact on the well-being of physicians everywhere. Until next time, take care, be well, and thank you for tuning in to Life-Changing Moments. Thank you for tuning in to Life-Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.